Hi everyone, this is Neel Raithatha, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with a blocked left ear. And as you can see, the ear canal is fully occluding. Now, the consistency of this wax plug was different in different parts. So this more lateral wax that I'm removing at the moment is quite soft and stodgy, whereas the main plug, and I have got a still image of it at the end of the video, so do stay tuned, was a lot firmer and it came out in a single piece. So to help me remove this more lateral, softer, stodgy wax, I've just instilled some medical grade olive oil spray. I'm using our medium size WAXscope specular here, which is got an internal diameter of 4.25 millimeters, which is the one that I use most regularly in clinic. We have got a smaller one for pediatric ears or just patients with narrow ear canals, and then two larger sizes. So if you are an ear care specialist and you're interested in the WAXscope, please do email info@clearwax.co.uk. And I'm just trying to work around the edges, just bringing it in off the canal walls. There is a bit of skin attached to the periphery of this wax plug, which is still semi-adherent to the canal wall. You can see I'm just going around the edge, and you can really see the texture and the detail of the skin with the WAXscope. So the more medial plug was quite tricky to remove. So I've perhaps removed about a third of this plug already. So we've still got 2/3 to go. So this wax plug was fully immersed within the ear canal. It was extending from the entrance all the way to the eardrum. And as you can see, I'm just working all the way around the periphery. I'm going to go to the roof of the ear canal here. The secret with this type of more lateral, soft, stodgy wax is not to over apply pressure with the suction tip, because you then just risk indenting the surface of the wax plug and blocking the suction probe. I just changed focus there, and so with that, just double tap the app, so it's got autofocus. So with the WAXscope, because it's got great magnification, there's a trade-off. So the more magnification you have, the less depth of field you have. So it's like an ENT operating microscope. So an ENT operating microscope, they have very high levels of magnification, and the WAXscope almost resembles that level of magnification. But the more magnification you have, the less focal depth you have. And a good way of analysing that is if you just put your hand right in front of your face, it's very magnified, but it'll be out of focus. So then you pull it away from you, and then you'll get your focal point. So it's a shorter point. Whereas a distance in the an object in the distance rather, because it's less magnified, you have more depth of field. So with an endoscope, the iClearScope that I also use, it's almost got an ideal level of magnification and depth of field for wax removal. Similarly with an endoscope, there's a trade-off between magnification and field of view. So with an endoscope, the main benefit is that you can see all the way around you, that kind of bird's eye view almost. Sorry, not bird's eye view, that's a different type of view. Your fisheye kind of view, your panoramic view even. But the more field of view you have, the less magnification you have. And the more magnification you have, so with an ENT operating microscope or the WAXscope, the less field of view you have. So there's always trade-off. So the benefit with the WAXscope over the endoscope is the ability to stretch and open up the ear canal to insert the instrument. With an endoscope, it's a more difficult skill to learn. Some specialists really struggle to use the endoscope to dilate and straighten the ear canal, and hence why I developed the WAXscope as an alternative. If people can't use an endoscope at the moment, they're reverting to what we call head loops, head-worn microscopes, and I've got a couple at the clinic. Problem with those is it's got such low level of magnification. So if wax is near the entrance or the outer half of the ear canal, it should be fine. But when it's deeper in the ear or it's up against the canal wall and you need that precision to peel it away, you are limited with the head-worn microscope. With an ENT operating microscope, again, you get levels of magnification similar to this. In fact, the view is almost, it's very similar. But with an ENT operating microscope, it weighs a ton, it's not portable, and it does take a lot of training to use an ENT operating microscope because you're trying to acquire binocular vision, which if anyone has used binoculars, At first, you can get kind of double vision. You almost have to train your brain and your eyes to merge the image you're getting with your right eye and your left eye to form one single image. And it can take a bit of training to do that. So with the WAXscope, it doesn't have binocular vision. It has monocular vision because you're looking at a 2D screen. But you can still acquire depth perception with monocular vision. And the way you do that in terms of the WAXscope is focus. When things are in focus, you've got the depth. So this last plug is the last half of the ear canal. You can see the ear canal in front of you at the top. It's lower down. So beyond that part of the ear canal, the ceiling of the ear canal is wider and bigger. So this plug is filling up a larger area beyond that top part of the ear canal that you just saw. In other words, this plug is a lot larger than what I'm trying to remove it from. So I'm trying to drag it down from the top. So again, you can see I'm trying to get underneath that part of the ear canal so I can enter that larger cavity where the wax plug is trapped. And I'm just trying to give it these little wriggle movements. I've just put some more medical grade olive oil spray. And just by kind of teasing this, again, I'm separating it again from the back part of the ear canal. And these little wriggle movements kind of not only tries to force and extract the wax plug, but it can fragment it to make it into a smaller plug, which can help then bring it through. So again, I'm just going to go in. I'm just going a bit further this time. I'm going to dilate the ear upwards because that's the region where I need to remove this. When you perform the procedure, you can feel which part of the wax plug is being difficult and not playing ball. So I'm just bringing it down. And now I've got quite a decent suction grip. I can feel that. And then I'm just giving it these little wriggle movements. And I think I've mobilized it now. So it's loose. And now I'm going to drag it through. So I brought it to the entrance. And at this stage, I'm actually just looking at the naked ear with my naked eye. I'm not looking at the monitor because it's actually hanging out of the patient's ear. So you can just see how big this plug is because it's a bit of a job removing it from the entrance of the ear canal. So just again giving it a wriggle, almost there. And you'll just see the level of magnification this provides in a moment when we visualize the eardrum. So it'll be up close and personal when you look. So going in. I'm just going to adjust the focus, and the eardrum just looks like it's right in front of you, and that's the benefit of the WAXscope. So if you're moving the wax deep from the ear, we know this wax plug was adherent to the eardrum as well because you can see all the staining, so that was stuck against the drum. The right side was it was some non-occluding wax, although it looks humongous with the WAXscope because of the magnification, but I'm just going to remove that for the patient as well. The eardrum is already visible. So again, it's quite soft wax this. It's just stuck to the posterior canal wall. So that's the first piece. I think it just blocked the suction tube, so I just come out and unblocked it. Going to re-enter, going to widen the ear canal to gain access. I think it just blocked the tube again, so I'm just going to come back out, unblock the tube, and it's going to remove this last bit. There's a couple of hair strands matted to it. There we are. And then we're just going to focus onto the eardrum. And you're going to see the wax plug I removed from the patient's left ear. So it's quite a large, significant plug there, blocking up the ear canal. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.